So yes, it's possible to breastfeed after reduction, but there's a few things you should keep in mind. So if you look at the published literature about this, there's anywhere between like a 60% to a 75% chance that you can breastfeed, but that doesn't tell the whole story. Breast tissue is distributed throughout your breast. It's not just in a clump in one spot. So when you do a breast reduction, you always remove some breast tissue. The key to successful breastfeeding that the studies seem to indicate is leaving a clump of tissue under the areola that's still attached that extends all the way down to the chest wall. So that's really how most of us do breast reduction. So that's a win. And then the next thing that's important to consider is that having good support is very important. So having a lactation consultant, especially if you have trouble, is very important in getting everything to work properly and to help you through your breastfeeding process. So I always tell my patients that if you've had a breast reduction and you're interested in breastfeeding, I think it's really important to meet with a lactation consultant before you have your baby. Come up with a game plan to improve your output if needed, so you have good support in place and you're not waiting until that crying baby is looking at you. And then also remember, even if you can't solely breastfeed, you can often make enough milk for bonding. And so you may have to supplement with formula, but you may have that option as well. So in my practice, I have patients contact me all the time that have no trouble breastfeeding at all after a breast reduction, and I occasionally have a patient that has trouble. It's very unpredictable. So when you're going into a breast reduction and you haven't had children yet, you do need to consider that this may limit your ability to breastfeed in the future.